Okay, so this is the final lecture for Unit 2 on tissues. And this particular lecture will cover tissue repair, which is all about how tissues fix themselves whenever they're damaged. But not only that, this particular topic will also be what's known as your discussion question on your test. When you finish listening to this lecture and watching this lecture, there is a how-to video that you need to go and check out in the Google Classroom that will explain how your discussion questions are set up on the test. So that way you can be prepared and you'll know exactly what you need to do. The cool thing is that I always tell you what your discussion question is prior to the test. So that's like the one thing on the test that you know is going to be on there. You just have to prepare yourself. So for tissue repair, oops. The reason why we have tissue is that its job is to help to maintain boundaries, which we learned is one of the necessary life functions back in Unit 1. Its job is to protect us from invaders, and to do that, it has lots of defense mechanisms. We have our skin, which is tough and thick and protects us. We have mucus, which traps things and protects us. And then we have cilia, which sweeps the invaders out of the way to protect us. But whenever we have a tissue injury, now those barriers that we need to keep us protected have been penetrated. And so our body goes through an inflammatory and immune response whenever our boundaries have been breached. And so that's what we're going to do is we're going to talk about what the body does when we damage our tissue. So it's divided up into steps, and each step has several things that happen. So the first step of tissue repair is inflammation. This is our body's response to something that could be potentially dangerous. So what happens is immediately our part of our tissue that has been damaged, it is going to release chemicals from the cells that dilate the capillaries. Remember, this is a positive feedback mechanism because we know the bigger the capillary, the more blood, the more white blood cells, and the more clotting proteins that can rush to the site to begin to stop that bleeding. Once the blood gets to that spot and the clotting proteins and platelets are there, they will form a clot. And this stops your loss of blood, stops you from oozing blood out of that cut or that scrape, and it begins to hold the walls of the injury together. Because remember, that was maintaining boundaries. Now, the part of the clot that's exposed to the air is going to dry out, it's going to harden, and then it forms a scab. Now, under that scab in the body, our body sends out macrophages whose job it is just to eat up the dead stuff, eat up bacteria, eat up debris, and lymphatic vessels kind of push all those the nasty stuff away so that we can clean up that area. So that's step 1, inflammation. Now, after we've gone through inflammation, our body's next point is to make sure that we get blood going back to that site of the injury, because no blood means no oxygen and no nutrients, which leads to dead tissue. So we have to restore the blood supply through a process known as organization. So really, this is the first phase of repair. And so what happens is where the clot is, under that clot, our body begins to replace the scab, that clot, with a very, very, very light pink tissue known as granulation tissue. If you've ever knocked a scab off early, you've seen granulation tissue. It's kind of a pinkish white color. Sometimes it'll even bleed a little bit. The reason why it's the color that it is because there's lots of capillaries and it's not real thick yet. So the capillaries hold red blood, which is going to appear as pink in the tissue. It's also going to have some collagen fibers that are going to begin to lay down that collagen across that gap, start to bridge the gap together to make your skin begin to grow in that area. So organization keeps on going until the blood clot is completely digested by macrophages and the wound is totally covered by collagen, which is also known as scar tissue. Now, the last part of tissue repair is regeneration, which means remaking or regrowing, and fibrosis, which is just a fancy way of saying scarring. And all of this is going to affect or cause the permanent repair. So during organization, our epithelium, our new skin, was beginning to grow under the scab, and eventually it will work that scab off because the scab will get real loose and then it'll fall off on its own. The epithelium under it is going to be kind of thin. It's not going to look the same as all the tissue around it. So over the course of time, that epithelium will thicken and it will begin to look like the tissue in the surrounding areas. Um, Now, scarring is a little bit different. Scars may or may not show up. It's all going to depend on the severity of the wound. The more collagen that you have, the more likely that you're going to see or visualize that scar. If it's just one or two collagen fibers, you're never going to see it. It'll be there, but you won't be able to see it with the naked eye. So if you have a scar anywhere on your body, that's collagen fibers that you're looking at. And it's usually different than the tissue around it. It kind of has like a pearlized look to it. It'll be lighter, shinier than the skin that's around it. So the last thing that I want you to think about is how different wounds heal themselves. Some wounds you get hurt and immediately it seems like they're better, but others take a lot longer, and that's because of the tissue. The tissue that is involved will determine how fast that wound will regenerate its tissue. Epithelial tissue tends to grow back pretty quickly and it regenerates very well. Bone tissue regenerates well, but we know that it takes bone much longer to grow and regenerate than epithelial tissue. Smooth muscle is moderately. Cartilage regenerates very little. Remember, I told you once you get to adolescence, you kind of quit making your cartilage. But the most important, to me, the most shocking, are cardiac and nervous tissue. Your heart muscle and your nerves, once they have been damaged, they are damaged for life. They have no regenerative ability, which means that if you have a heart attack, you damage heart muscle and you will never get that muscle back. If you do something to a nerve, that nerve will be forever deadened and it will never work again. So that's important to kind of talk about. So that wraps up Unit Two's notes. I would definitely go back and watch the video on how to do your discussion question. Your discussion question for this unit will be how explain the steps of tissue repair, and you will need to explain all three steps and give what happens under them. So that way you'll be good and prepared. So if you have any questions, feel free to drop me an email and I will see you later.